Hello and welcome to the fifth webinar of this special series on alcohol policy in Canadian municipalities. My name is Amanda and I'll be introducing today's session and moderating the panel and Q&A. And the topic of today's webinar is Municipal Alcohol Policies and Beyond, Examples and Experiences in British Columbia. So our panelists for today are going to introduce themselves at the beginning of the panel, but here are the folks you'll be hearing from today. And to start things off, I'm going to invite Tim Naimi, the Director of Stere, to touch on a few points about alcohol in BC to just kind of set the scene for our discussion. So welcome, Tim.
So I'm just going to give you a few introductory remarks. I'm not really a panelist. I'm just doing a bit of a kind of overview. And I just wanted to get us started by looking at a little about the background of alcohol sales in BC to get us kind of warmed up. And what we're looking at here is a chart that shows the range of consumption patterns across BC by the 5 regional health authorities. And there's a different color that represents each of those health authorities. There's a map in the upper right, and you can see those colors, and then those colors correspond to the bars. So, for example, we see here that in East Kootenay, which is the oval circle on the left, that had the highest number of drinks per week at 14, whereas Richmond, the oval circle to the right of that, had the lowest at roughly 4 drinks per week. And then in addition, we've got a little figure there at the bottom right, and that is using data from Stats Canada, Canadian Substance Use Cost and Harms, or CSUCH study. It's also possible to estimate the net surplus or deficit in terms of costs in BC. And again, that's that little box on the right. So you can take the total revenues from government from the distribution and sale of alcoholic beverages compared to the public costs in terms of healthcare, criminal justice, and economic loss of production. And so for BC, the deficit was estimated, I think this was in 2020/21, at 768 million Canadian dollars, which comes out to 33 cents per every standard drink sold, that essentially the government is paying that, or meaning that the taxpayers are paying that. So that's a subsidy. And I also wanted to mention is that we think about this in terms of municipalities and costs. We might also start thinking about other things that might not be reflected in the provincial accounting, things like policing costs, trash collection, transportation issues, and other things that aren't necessarily easy to quantify. Next slide, please. So now we'll look at some data by local health authority. So that's within these health authorities, there are smaller units called LHAs, or local health authorities. And we're looking at one of the 5 health authority areas within that, which is Island Health, which is within that. And two regions that our panelists are coming from today. One is Alberni-Clayoquot, which is the 5th bar from the right-hand side, and Vancouver Island North, which is the right-hand bar. Both have relatively, for what it matters, both have relatively high levels of per capita alcohol consumption compared to others. And I want you to keep in mind, by the way, that these data are based on sales. And as we drill down to smaller and smaller areas, we should remember that there's less of a correlation between what is sold and what is consumed. So if you're in a very small geographic area, it's increasingly likely you may drive into another small neighboring one to purchase, or vice versa. And also we have to remember that there are issues related to people who are coming in and out for tourism purposes. This is from Ruth's home territory. This chart is similar, just showing Fraser Health. These are all the bars are the local health areas within Fraser Health. And again, you can see pretty much of a variation anywhere from 4.5 to 16 standard drinks per week per person. Next slide. We know we have folks, of course, joining us today from across Canada. So we wanted to mention a few points about the BC local government context. So the first is that in BC, there are 161 municipalities, 27 regional districts, we're going to return to those, 5 regional health authorities, and 202 First Nations government. These regional districts are unique in Canada. and they act as a federation of both incorporated municipalities, so those 161 up above, as well as unincorporated rural electoral areas. Municipal councillors often serve on their local municipal councils and also sit as directors on a regional district board. This system ensures that municipal governments play a direct role in the regional service provision and finance operations. And then I wanted to mention that municipalities are governed by the Community Charter and the Local Government Act in BC. But Vancouver is governed by the Vancouver Charter. So in terms of this last bullet, it's good to remember that municipal powers are generally delegated by the province through acts like the Community Charter. And it's also interesting to note that not all municipalities in all provinces are governed by one or the same charter, as in here in BC, Vancouver gets special treatment. Next slide. So in BC, there are a variety of examples of local governments that use policy tools in relation to alcohol. This slide mentions a few of them. And here we're looking at what's called the Municipal Alcohol Policy Continuum, where you can have municipal alcohol policies that pertain to public spaces and private events. If you want to make changes in liquor licensing policy, you generally have to go through the provincial, through the LCRB. And then community alcohol strategies involve the most engagement and effort. But these would be things like that could range from examples like control over advertising, event policies, land use planning, and use of municipal properties, this sort of thing. And it's also important to note that not all municipalities have identifiable or dedicated municipal alcohol policies, though I'd like to hear more about that from our panelists, because they're obviously coming from places that tend to have more of these policies in place. Okay, next slide, please. The last one here, these are some resources available for local governments and communities in BC. And I will now pass it over to Amanda to facilitate the real panelists. And thanks everyone for coming.
Thanks, Tim. I'm now going to invite our panelists to sort of introduce themselves with their name, position, and where they're joining from today, and their role in municipal alcohol policy and what it looks like for context, just to give people a little bit of the lay of the land before we launch right into questions. Tom, would you like to get started for us?
Great, thank you for the introduction. My name's Councillor Tom Stere. I'm a district councillor in Tofino, and I also sit on our regional government as well, the Alberni-Clayoquot Regional District. And I'm coming to you from the west coast of Vancouver Island on the unceded territory of the Clayoquot First Nation.
I'm just going to go around in order. Ruth, you're next to me on the screen.
Great. Good day, everyone. I'm with Fraser Health Authority. My name is Ruth Hellerud-Brown. I'm calling in today from the traditional and unceded territories of the Squamish and the Tsleil-Waututh Nations, and I'm ever so grateful to live and work on these beautiful lands. I'm the project leader for Legal Substances, which is a team of 4 within our wellness promotion program in population and public health. I'm actually, by trade, a registered dietitian, so go figure. But transitioned into tobacco work quite some time ago. The tobacco portfolio within our program was broadened in scope to include legal substances. So of course that meant for us work around cannabis and of course alcohol. And later on today in the webinar, we'll talk about what the focus of our work is, which is centered on municipal policy changes.
Thanks, Ruth. Gwen, would you like to go next?
Perfect. Thanks, Amanda. Hi, I am calling from the traditional and treaty lands of the Tsawwassen First Nation, and I am very grateful to be here. I currently work with Ruth as a community health specialist on our Fraser Health Population Public Health Legal Substances team. I've been working in substance-specific health promotion for about 20 years, with much of that work focused on alcohol policy. The first 15 or so of these years were in Nova Scotia, where I had opportunity to work closely with my local municipality. In those days, we worked together to tell the story of how alcohol shows up in that community, and that began our wider Nova Scotia Alcohol in Our Towns project. I also co-authored Progressive and Prosperous, an alcohol policy guide for Nova Scotia municipalities. Originally, I am from BC, the lower mainland of British Columbia, and came home 5 years ago to join the Fraser Health team.
Thanks, Gwen. Faye.
Thank you. Pardon me. My name is Faye Missar, and I'm joining from Ucluelet in Ucluelet territory on the west coast of Vancouver Island. I am a community health promoter working for Island Health for Alberni-Clayoquot region. And my experience with municipal alcohol policy started years ago advocating to Tofino to develop a municipal alcohol policy, and then more recently supporting Port Alberni and District of Ucluelet in creating a municipal alcohol policy. And now I'm co-leading with District of Tofino in supporting the preliminary planning and engagement for a community alcohol strategy. So yeah, thank you.
Thanks, Faye.
Pleasure to be here.
And last but certainly not least, Lyndsay.
Thank you. Good morning, everyone. I'm grateful to be joining today from Campbell River on the traditional territory of the Likwitah people. I'm a policy lead on the Healthy Public Policy team at Island Health, but by trade was a municipal planner for many years before this. And the topic of alcohol is a focus for our Healthy Public Policy team. And we've conducted a fair amount of research on alcohol use and harms and available policy levers to municipalities. We've developed information packages for municipalities, and we've supported community groups and municipalities along with the community health promoters such as Faye in discussing and creating municipal alcohol policies and community alcohol strategies.
Thanks, everyone. Really looking forward to diving into this topic. So I'm going to get started with a question. What are some strategies that can be used to engage municipalities in considering the development of a municipal alcohol policy or community alcohol strategy? So Ruth, would you like to answer that one first, please?
Sure. So first out of the gate, and thanks, Amanda. So at present here in Fraser Health, and Tim, this one's for you. We don't have any municipal policies as yet, nor any community alcohol strategies. And having said that, several years ago, one of our communities did take advantage of a BC municipal alcohol grant program to lay the groundwork for policy, but unfortunately, nothing materialized from that. So far that in Fraser Health, that's been the extent of interest regarding like an overarching type of municipal alcohol policy. Because of this, our approach in engaging municipalities to consider a map is at the very early stage. We're essentially working with municipalities in terms of where they are at right now rather than where we want them to be. This involves being on the alert for any policy window that comes up. So in essence, we're focused on smaller policy options with the goal to build municipal interest, buy-in, and eventual readiness. Over the past years, this policy work has centered on bylaw development or amendments to permit alcohol consumption in parks and to permit wine in grocery stores. We also had one small, quite nice piece of work with one community where we provided an evidence brief for their revision of their liquor and cannabis policy. So the lay of the land in Fraser Health is that we've got 20 municipalities that vary from large urban centers to small rural communities, as well as 2 of those regional districts that Tim outlined. So far, we've worked with 7 of our communities and 1 regional district on bylaw activity related to alcohol and 1 municipality on wine and grocery stores. Our engagement consists of working with staff and or politicians to find common ground and then formally addressing the policy through medical health officer recommendations, often through a letter or delegation to mayor or council. Issues that are addressed include the overarching health impacts, of course, as well as access, availability, health equity, evaluation, and monitoring. Strategy-wise, first and foremost, we look to build relationship with our municipal partners. We're able to do this through quite a unique structure that we have within our program. This is done through 12 community health specialists that we have. We call them CHSs. And they work across our geographic regions. The CHSs work working with municipalities, build relationships and engage on varied topics. They work with multiple departments and with staff and politicians around shared health and municipal issues. On top of that, we have our legal substance team, which are 3 in the region that support this work through content-specific expertise. All of this is very strongly supported by our geographic MHOs, who provide oversight and leadership to the team throughout this engagement process. To find policy windows, we're constantly monitoring council agendas and minutes, and one of our main sources, sadly, is the local media. So we scan the news to find out what's been reported on the most recent council meeting, and often then can go forth with our work. In our municipal engagement, we work to build a trusted partner by offering whatever supports we can. So for example, if we don't really get buy-in with what we're recommending on a bylaw change, we'll offer support in other aspects in terms of it might be links to some reliable health information, evaluation support, or recommendations around signage, if that's applicable. Part of our work is to engage municipalities around issues that create resilient and connected communities. So these are interventions that aren't specific to substance use, but would impact use, that is, changing the culture. So important to this piece of work is another component of our program, the PACES, or the Positive and Adverse Childhood Experiences CHS team, who are involved in that part of community development. Another key piece that we've gained some experiences is our social marketing campaigns. We've done 2 Now You Know campaigns, and have taken the lead in securing funding and engagement of all 5 health authorities, First Nations Health Authority and Métis Nation BC, on a current province-wide campaign. So that's a summation of our policy work and our approach. We recognize that we're not within reach of an overarching policy, but we continue to work toward that goal. Thank you.
Thanks, Ruth. It's always so interesting to hear the continuum of where everybody's at in this work, and it's all important, right? So, Lyndsay.
Thank you, Ruth. I guess I would reiterate a few things that you said. Island Health has worked in very similar ways in terms of having community health promoters that live and work in each region. So they have a very good understanding and knowledge of the communities that they live in, and they recognize potential champions in those communities too, such as Faye, who will speak about this later. And they work to build relationships in the same way. So that's a very important part of considering the development of policies. Medical health officers as well have been very intrinsic in building some momentum in communities. So starting with general presentations on just general health of the population, and including some slides about alcohol just to start the conversation. And then possibly going back to those municipal councils and presenting more specifically on alcohol and data in that community on consumption and harms and possible policy levers available. Thanks.
Thanks, Lyndsay. So next question, what have been some key factors in your organization or community's ability to develop a municipal alcohol policy or community alcohol strategy? And I'm going to direct this question to Tom.
Great, thank you. This is a perfect segue because I think Lyndsay just touched on the one point that I'm going to bring up almost immediately. And some of the key factors in the initial development of our municipal alcohol policy, and then I'm going to let Faye follow up with our community alcohol strategy, which we just, as she mentioned, started to engage in. But at that municipal, at our first presentation from our medical health officer, that was a key factor in moving forward with development of a municipal alcohol policy. At that initial meeting, it was informing council of the number one public health and safety issue in our region, which was alcohol consumption. So from there, the big question was, well, what can we do as a municipal government? And they were able to provide us some clear direction on what tools we had available to us. And so one of the big ones that we started to engage with was on a municipal alcohol policy. So that at that point, you then need the consent of council to move forward with that. And so with good discussion within council, we decided to allocate the resources through a motion to develop a municipal alcohol policy. So what does that mean? Well, that in this case, staff are tasked with that role. One of the first questions is looking for direction on how we would like to approach it. In Tofino's case, we wanted to look through a public health and safety lens. Many municipalities in other jurisdictions look usually through a liability lens. We really wanted to focus our attention on what was identified and is our responsibility as a municipality for the community well-being. So within that direction, we gave clearly to our staff to engage in that public health and safety realm. Also, some of the foundational principles of that were inclusivity, engagement, and support. So those gave clear directions for our policy team here at the municipality to start developing that. One of the key factors, of course, is the public engagement aspect of that. And I think Faye's going to touch on that, I think, in our community alcohol strategy work that we're being doing. So one of the other factors that, especially for small municipalities, is the fact we don't have a lot of money. And so sometimes funding it can be a key factor in there. And we were fortunate enough to be able to have allocation from council for a municipal alcohol policy towards that. And then we've been fortunate, as we'll speak later in the community alcohol strategy, to a Plan H grant, which had afforded us the ability to start the planning process. And I think Faye will speak a bit more to that as well. And I think one of the other key factors that was there is the community involvement for them to be fully educated and understand what the impacts of alcohol within our community, being informed from our medical health officer. And I cannot overemphasize how important that was in giving the council direction in terms of addressing that public health issue in our community.
Thanks, Tom. And that, segues into our next question. It's almost like we planned this. And so what have you learned about the process of developing a community alcohol strategy? And Faye, did you want to get us started on that as Tom kind of threw it to you there a little bit?
Yeah, thank you. Lyndsay and I were going to answer this one together. So I don't know, Lyndsay, did you want to start? And then we'll segue into what I have prepared.
Sure. I guess looking into developing a community alcohol strategy, we kind of first looked at some good examples that were out there already in BC and Canada. From those examples, we discerned that there was really no formula or one size fits all for a strategy. They can take many forms and have a lot of different sections and parts and topics within. We looked at a few examples in BC and also one in Prince Albert, Saskatchewan, and spoke with many involved in the creation of some of those strategies. And we found a range of formats and content. One focused on event regulations and social norms to shift after the issues with events in the community. And included policies for each municipality in the region to implement, so sort of like a smorgasbord of policies. Another took into account issues with nightlife in the downtown area and focused on liquor license criteria and with the intent on reducing harms and giving responsibility to businesses. And one was, and still is, an ongoing strategy administered by a steering committee focusing on industry and community responsibility and includes education and prevention strategies and initiatives. So a lot of different things that could go into a strategy, and it could be just events or it could be a lot more than that. Each strategy included a background into the need for change with respect to alcohol use and harms in their communities. They included guiding principles, community-wide consultation, and implementation support. In in terms of unique characteristics as well of communities, I guess in approaching communities or evaluating their interest, a lot of unique characteristics across the island could be evaluated. There's varying consumption levels, for example, across Vancouver Island, as was noted in Tim's introduction. And so that could be one factor in starting to develop a policy or approaching communities. Many island communities are tourist destinations, and so they rely on this industry for economic development in some ways. This comes with a perceived or real need to support the tourism industry through social activities that may involve alcohol, such as restaurants, nightlife, and events. It should be noted that tourism does drive up alcohol use statistics in some areas. However, these areas still have higher alcohol use regardless. And finally, many communities are considered remote or rural on Vancouver Island and in the Island Health region. So there may be less activities or support in the community for youth and adults, which may lead to alcohol-related activities and less services for those requiring support to reduce alcohol use. So just some factors in terms of getting started on a community alcohol strategy and things to consider. And I will turn it over to Faye.
Right. So I'll just start by saying that I believe the municipal alcohol policy is a great first step, but we also recognize that it is more narrow in scope and it's not really enough, at least in the Tofino region, to be moving the dial on alcohol harms and social norms around alcohol use. So that is what had led Tom and council to consider looking at developing a community alcohol strategy. So in Tofino, we've brought together a diverse steering committee to guide the work, with each member representing a specific sector or population group that are integral to engage with in order to develop a robust strategy. So for example, we have our medical health officer, we have leadership from Tofino, Tom, a Howzit and Tlokwiat First Nations. We have representation from our health network, a substance use outreach, our CMP, and Tourism Tofino. So right now, we are in the initial stage of community engagement, and our steering committee members are supporting us in designing the best ways to engage with their respective population or sector. So in essence, we're really leaning on existing community champions and hopefully also building up others. We have right now a region-wide survey that we're working on that will be launched in the next few weeks. And this is aims to educate and raise awareness with the general public about why we are undertaking a strategy, as well as to gauge their support and readiness for said strategy, and to understand alcohol harms from the community perspectives and understand their ideas, if any, for strategies to start addressing them. And then we will also have more targeted engagements with certain groups, such as a Howzit, Tlokwiat, the health and social services sector, people with lived living experience, child and youth families. And then from all this information, we'll be drafting recommendations to include in a community alcohol strategy. And this will go to Mayor and Council this coming fall for approval and adoption, hopefully. And one more piece is in doing our homework, like Lyndsay discussed earlier, our steering committee will need to decide whether our strategy is an ongoing collaborative effort or more of a standalone document. I feel like it will likely be the former, as there are many complexities at play in the region when it comes to addressing alcohol. The strategy will likely include multiple pillars, including policy recommendations, education and awareness initiatives, and advocacy for more community-based services. And what I have really learned from being a part of this work for the past several years, more broadly in alcohol work, is how important it is to have local champions who can really drive this work and influence others. And I'm hopeful, and a goal of mine is that through these engagements in the community, another champion or two will emerge, and ideally in the tourism hospitality sector.
Yeah, thanks, Lyndsay and Faye. It's just so fascinating to hear all the work that goes into this stuff. So next question, I'm going to direct it to Gwen. What kinds of resistance barriers or challenges have you experienced in your region?
Thanks, Amanda. So great listening to people's stories, because I think you could read between the lines around some of those barriers. But for us, and probably no great surprise to many of the people on the call, our greatest challenge has been around how normal and accepted alcohol consumption in our communities is. And this, of course, is combined with the overall lack of awareness, perhaps lack of interest even, in the harms and costs of alcohol. So we know that policy decisions meaningfully influence societal norms, for better or worse. BC provincial alcohol regulations have been relaxing since 2014. This has been characterized as kind of modernizing our alcohol policy. These actions contribute to the long-standing acceptance of alcohol as a harmless commodity, rather than a substance of harm. And we're seeing this reflected in many municipal governments where there's very little political will to act on alcohol harms. Discussions have generally focused, where there's willingness to discuss, the discussions have focused on kind of that obvious level, disruptive behavior, litter, broken glass, bathroom issues, rather than the wider health and social impacts. We've also found that since COVID, there has been more public acceptance around relaxing policy in general and more focus on increasing economic development. So I was interested in listening to Lyndsay discuss tourism and economic development. We've also experienced some challenges around that. Alcohol is being positioned as a facilitator of revitalization, making the city a fun place to be, and attractive to visitors, which goes hand in hand with the desire to support and promote local restaurants, pubs, breweries, distilleries, and the like. So we have in our communities emerging, in a number of our communities, like these, brewery rows where you can wander from brewery to brewery. However, in the midst of this, it's not all bad news. There are a few key elected voices that are emerging, that are emerging and speaking about how alcohol is a drug with real and significant impacts on community health and community safety. And we're finding this very hopeful. That these elected leaders may be future champions of more coordinated municipal alcohol work is our hope. And so we're listening to see where these voices are coming up and how we can work with them. But a couple of other things around barriers I'll continue on with. And this is perhaps unique to the BC experience. There was confusion with how public health alcohol policy aligns with other public health drug policy. So BC efforts for decriminalization landed poorly with a number of municipalities who had considerable concern and heard from their constituencies considerable concern about public drug use. Many of those municipalities moved to pass bylaws that ban drug use in parks, which from a public health perspective was quite problematic in terms of stigmatizing, driving people to indoor use, etc. But interestingly, from the municipal point of view, this did not translate to concern with public alcohol use. Rather, with a frustration with the seemingly mixed messages that public health was suggesting leniency on public drug use, including use in parks, on one hand, but recommending not allowing alcohol consumption on the other. So this fundamental misunderstanding of these two approaches set us back in our conversations with some municipalities. and again speaks to, in terms of how alcohol was being treated differently in municipalities as an issue of concern, speaks again to that normalized commodity of alcohol. So finally, I just wanted to mention that time, the realities of time is an issue. Often by the time we hear of an issue coming before council, we have limited time to respond. We may get wind of a news report or notified at the last minute about an upcoming agenda item, but we're limited in our ability to coordinate more meaningful response by potentially engaging key partners, like whether that be schools or other community organizations with shared concerns, that would allow us to demonstrate a broader public interest, which would be ideal. At best, timing often allows us only to prepare delegations, Fraser Health delegations, where we can go directly to council and then follow up with a letter. Typically, our work centers around engaging with staff or an elected official, following up with an MHO letter outlining recommendations. Bottom line, entertaining the idea of a municipal alcohol policy or a wider community alcohol strategy right now is not a priority for most of our municipal leaders. And we, as a health team, have to creatively find ways to work around that.
Thanks, Gwen. And it sounds like, hearing from you and Ruth, you have been doing that, very much doing that. So I think that Lyndsay and Faye touched on this a little bit, but a question, I'll direct this one at Tom. What has been your experience of relationship building and engagement with First Nations, Treaty Nations, and Indigenous folks in your communities around this work?
Great. Thank you for the question, because it's an important one in terms of relationship building in general, but very specifically in our area, there is a disproportionate effect of alcohol consumption on our First Nation communities. So in a small town, I have the fortunate to have developed those relationships at a personal level. Our kids go to the same school and play the sports together. And so those relationships get built at the ground level. My wife also works in the health field up at our large community of Howsett to the north of Tofino here. So at a personal level, we have those day-to-day relationships. At a political level, where those conversations come in, there's formal and there is informal. So the formal is agreements that we have with our First Nation neighbors here. So we have MOUs, memorandums of understanding, which is well laid out in terms of the protocols on how we meet. And then we have what we've just developed most recently with the Clayoquot First Nation, is what we refer to as a friendship accord. And that's more to recognize the shared concerns of our communities and how we might be able to address those together in a collaborative form. So it really comes down to relationship building in a very direct way. It is all about relationship. And one of the challenges that come with municipal governments, as well as those external groups that do come in, is they change. So once you establish a relationship, the continuity of that relationship also becomes key. And once again, as you know, as we're having municipal elections coming up in October, there will be a change in that municipal government. There are changes in the staffing levels at LCRB and Island Health, and the list goes on. So how you have that continuity of relationship is critically important. And I think by identifying within those organizations, direct liaisons with the Indigenous communities are critically important. At the local level, once again, we recognize clearly the land title holders that have been for thousands of years, and we respect that. And I think, once again, the key is relationship building and listening. I'll leave it there.
Thanks, Tom. It's amazing how powerful it is to just show up and, in person and, listen to a community. Did any of the other panelists want to address this question? We're just getting ready to wrap up the panel discussion. So
I would just quickly add that, yeah, listening, showing up, and then following up. And that's how you show reciprocity and accountability. I helped a bit in that follow-up, is like, you came to community to hear about this, you really heard about this, so about this issue instead. So now what are we going to do? Now how can we continue this conversation and keep the ball rolling on that too? And that builds trust and yeah, shows that we want to work together and collaborate and support each other. So I would just add that little piece. Thank you.
thanks, Faye. So thanks to all our panelists. We're going to move on from the panel portion to the Q&A portion.